Now, when evaluating patients with chronic conditions for environmental exposure or accumulation, there are multiple different lab testing that we can use. There are labs that use hair, whole blood, or urine samples, and each one has their own unique advantages or disadvantages. Each one of those lab testing might measure different chemicals, so it's really important for us to know exactly what it is that we're looking to measure, understand the mechanisms and the symptoms that are involved, so we can make sure that we are ordering the appropriate lab for each patient. Here's an example of a heavy metal analysis test that is a result of a patient that is 58 years old, female with hypertension. You can see highlighted in this lab result that aluminum, titanium, and tin were higher than normal levels, which we typically see in the green area. And so when we look at some of the research that was published within the relationship between heavy metals and hypertension, we can see that aluminum is a non-essential metal and is a significant environmental contaminant and is associated with a number of human diseases, including cardiovascular diseases. There was an animal study published in 2017 reported that exposure to aluminum at human dietary levels impaired the cardiovascular system. And those effects were almost the same as aluminum exposure at much higher levels. Aluminum increased systolic blood pressure and decreased acetylcholine-induced relaxation, endothelial modulation of the vasoconstrictor responses, and the bioavailability of nitric oxide, and the involvement of potassium channels in vascular responses. Aluminum also increases the reactive oxidant species, which are known to be associated with cellular damage. A human study published in 2022, including 1,546 adults, concluded that plasma levels of cobalt, aluminum, and calcium were found to be associated with the risk of hypertension. And this is why it's so important for us to know the mechanisms of those heavy metals and understand when a patient comes to see you with chronic conditions, could either metabolic dysfunction or cardiovascular or an autoimmune condition, hormonal imbalance. It's really important to understand the mechanisms, the labs, and the treatment strategies. Here are some of the citations for that. And then when we're looking at a few of the simple strategies that we can help our patients to better eliminate some of those chemical accumulation, this is one simple example from one particular study that reported that children between the age of 5 to 12 years old received 15 grams of pectin with a product called Pectasol, which patients can buy pretty much online or in some of the natural food stores. And they divided it into 5 grams dosages throughout the day. The blood serum and 24-hour urine extraction were collected and were performed on day 0, 14, 21, and 28 days into the study. What they found was that the use of pectin, 15 grams of pectin a day, significantly decreased the blood serum levels of lead and dramatic increase in 24-hour urine collection. So here's just one simple strategy that was found to be beneficial and can be used by children and adults to bind and support the elimination of some of those heavy metals. And of course, there are specific protocols for those different heavy metals that we include in our comprehensive training.